So in the summer of 2007, I was at St. Gabriel's Hospital, which serves 250,000 people spread 100 miles in every direction. Patients are literally walking 60, 80, 100 miles to the hospital for healthcare. And they've turned to a network of volunteer community health workers, about 450 of them, to serve as home-based care providers and health advocates in their respective villages. But in 5 weeks, I noticed that they were just as disconnected from the hospital and its resources as the patients were. So in the summer of 2008, I returned with a small public service grant from Stanford, enough money to buy 100 recycled cell phones, a laptop, and a plane ticket back to the hospital. And we essentially brought in community health workers, taught them to text message, and sent them back out to their respective villages, and really let the function of the program develop organically from what the communities and what the hospital needed. For the first time, the hospital is able to respond to remote requests for patient care, track HIV and TB drug adherence, as well as disseminate health information. The sticker price for the system sits at about $500 a year, and in the first 6 months saved the hospital about $3,000 in motorbike fuel alone. They doubled the number of patients they're treating for tuberculosis, and it saved the staff about 3,000 hours in work and travel time.
So now we've jumped from 250,000 patients to 1.2 million patients in less than a year, and that was all on the basic FrontlineSMS platform with a few minor clinical modifications. Now moving ahead into the rest of 2009, what we're doing is we're reworking the core FrontlineSMS source code into a completely new medical platform called FrontlineSMS Medic. And what that will do is it will take Frontline forms and make them into electronic medical records for patients. And those electronic medical records will be plugged into the Ushahidi system so that they're GPS tagged. So now as a small clinic, you can do things like GIS, you can do epidemiology on a laptop. And then moving ahead even further into early 2010, we're working closely with OpenMRS so that our system will interface with their system for larger scale clinics. Now, the big innovation that's getting a lot of buzz right now is called Cell Lab. And what this is a new diagnostic protocol which will allow CHWs, community health workers, to do critical medical diagnostics for malaria, tuberculosis, and HIV for less than $1 in a matter of seconds at the point of care.
So what makes us different from the competition? FrontlineSMS Medic is low cost, locally appropriate, and we scale horizontally. Our software is free and open source. We acquire computers through university donations and cell phones through a large-scale recycling campaign. Unlike other telemedicine initiatives, we don't try and impose prohibitively expensive technology on clinics, nor do we try and tell them how to use our networks of care. Rather, we work with local partnerships so that they can manage their own sites independently of external support.